Okay, so an experimental vaccine from Moderna and Merck shows promise in cutting down the risk of melanoma returning.
Joining us to talk about new clinical trial results is 9 News medical expert Dr. Payal Kohli. Welcome.
Hi guys, I'm so excited about this trial.
And we just want to know a little bit more about the concept of a cancer vaccine. How is it made? And just to be clear, this is not a vaccine that is to prevent cancer.
No, so when we normally think about a vaccine, we think about get vaccinated to prevent an infectious disease. Now, there are some cancers like cervical cancer, for example, penile cancer, vaginal cancer, others, where you give them HPV vaccine, human papillomavirus, to prevent it. But this is actually a vaccine to treat the cancer. And the idea here is that cancers are very different from normal cells. So the way that a cancer forms is that it accumulates a series of mutations. So instead of having normal proteins, it has these cancer proteins that are called neoantigens. So what if we could train our immune system to recognize the cancer cells and use our immune system to fight the cancer? So the idea here would be to take a patient who has melanoma, take out their specific cancer, get its signature, and then make a vaccine that trains the immune system using AI to identify which proteins, inject it back into the person, and now their immune system knows how to identify the cancer.
That's amazing. I want to know more about what the study says, but I have to ask you this question because you just used your sentence was a vaccine to treat cancer. So people will hear that. And my question is, what's different between a vaccine to treat cancer or a cure for cancer?
Well, what we're hoping for, Phil, is that one day we could use these vaccines to cure cancer. But the idea of what we're trying to do right now is that our approach to cancer treatment has been backwards up until now. What have we used? Chemotherapy. Chemotherapy is poison, but it's poison not just for the cancer cells, it's poison for all the cells. So when you give a patient chemotherapy, you kill the cancer, but you cause a lot of toxicity or side effects. So here the concept is a more personalized approach where you're targeting only the bad cells, and again, using the immune system, which is part of our body, it's surveilling all of our cells all the time to really try to make sure that cancer doesn't come back. Because even after you cut it out, we know that microscopic cells are left behind that radiation therapy, for example, may not get and may still start to grow.
It's really interesting work, but are there any side effects?
So the nice thing about this particular trial is they gave patients with stage 3 or more melanoma this vaccine versus not giving it. They looked at rate of recurrence, and it cut the rate of recurrence. It also cut the risk of metastasizing by about 60%. Now, we know here in Colorado, melanoma is one of the top 10 causes. You know, the death rate from melanoma is one of the highest, so it's really relevant to us. But the good news is it wasn't toxic like chemo. It really was just very much like a vaccine. So patients for a couple of days had fever, chills, some headaches. But imagine cutting the recurrence rate in half, cutting the metastatic rate by 60%, and the only price you pay for it is just a couple of days where you might be feeling a little bit under the weather, just like we do when we get the flu shot, for example.
As opposed to anybody who knows anybody who is or has been through themselves, chemotherapy can be brutal.
Yes.
And that has been like the only way, you know, that was the one treatment. How far along are we with this? How much more needs to be done? When will it become common?
I'm hoping it's right there on the horizon. So we need one more trial. A large-scale trial is undergoing right now, enrollment in Europe. As soon as they complete that trial, it may now become what's called the standard of care, which means that when a patient has melanoma after surgery, in addition to immunotherapy that we've been using, we layer this on top. And, you know, I really want to recognize former President Jimmy Carter here because his melanoma battle really changed how we think about melanoma, immunotherapy, and cancer treatment in general. So I'm hoping this is huge news, that this really boosts the way we think about cancer kind of into the next century, where we can start to use a combination of technology, AI. Obviously, the barriers for this are going to be cost. Every person's cancer signature looks different, so you have to make a personalized vaccine, and it takes weeks to do so. So we have to work on getting those timelines shorter.
I can't decide if it's taken too long or it's pretty quick in the span of human life. I don't know which one it is, but thank heaven it's happening, because if you've had a loved one, you've lost to cancer, it is absolutely awful. Dr. Kohli, thanks so much, as always.
Thank you.